Hi everyone. You walk into a doctor's clinic. You have questions in your mind. You sit down in front of them and don't know what exactly to ask. You walk out of the clinic and all those questions start coming back to you. Let us learn more about the baby before you go to the doctor so that you know what exactly to ask, what exactly to learn in our patient education program, Pep Talk. Today, let us learn more about Trisomy 21, that is Down syndrome. So what exactly is Trisomy 21? To know more about it, let us first understand how our body develops from the DNA. DNA is the recipe book and it tells our body how to manufacture cells so that certain cells can help us see, certain cells can help us talk, and some can help us walk. All this information is tightly packed in the DNA, and DNA itself is tightly packed into small bundles called chromosomes. We have 46 of them, 23 from the mother and 23 from the father. Some babies get an extra copy of chromosome number 21, meaning they have 3 copies of chromosome 21 or trisomy 21. This is also called Down syndrome. As Down syndrome is the commonest cause of intellectual disability, for more than 4 decades, doctors have been trying to identify if the baby inside is suffering from Down syndrome or not. Combined test. It's supposed to be one of the most accurate screening tests, which tells us not only about Down syndrome, but much beyond. It involves an NT scan, a blood test, wherein hormones like HCG, Papain and placental growth factor, which come into your body from the baby, are measured. These are put together in a complex algorithm, which looks at not only your weight and height, your blood pressure, certain measurements in the scan, and certain chemical measurements. These all put together help us calculate the risks of your baby developing Down syndrome. Combined test beyond Down syndrome gives us much more information. It tells us about an extra copy of chromosome 18, also known as Edwards syndrome, extra copy of chromosome 13 called Patau syndrome. Not only this, it tells us about chances of high blood pressure a mommy can develop in this pregnancy, chances of growth restriction, baby being underweight at the time of delivery, and chances of premature birth, baby coming out before the full term. As many as 25% pregnancies are affected by one of these 3 causes. Not only this, the ultrasound scan between 11 and 14 weeks help us find out heart defects, spine defects, abdominal wall defects. As many as half of the birth defects can be found out in the scan done before 14 weeks of pregnancy. So NT scan can only be performed between 11 to 14 weeks of gestational age, meaning when baby's crown rump length is between 45 and 84 millimeters. Less than 45 mm babies need to come back, but if the baby is longer than 84 millimeters, we cannot offer combined test. For these babies, there is a slightly lesser accurate screening test called Quadruple Marker. Here is an important point. Remember, combined test, Quadruple Marker, or even NIPT are screening tests. The screening test cannot tell us if the baby is healthy or if the baby has a disease. What it tells us is the likelihood of baby being healthy or baby having the disease. In other words, many babies who are high risk for the disease are going to be normal. And there may be a once of baby who was actually marked low risk in the screening test but had a disease. This is very important to remember because if your baby has high risk or intermediate risk on Down syndrome, we are going to offer further testing, either invasive test or an NIPT. However, for the low risk babies, we do not offer any further testing. Diagnostic tests are the tests which provide us very accurate results, and thus they are offered to the patients who screen high risk on either of the screening tests, may it be combined test, quadruple marker or an NIPT. In diagnostic test, what I do is put in a small needle through mommy's tummy and sample baby directly. When done before 14 weeks, I sample the placenta, also called as CVS, chorionic villus sampling. After 14 weeks, in amniocentesis, I take water around the baby by putting in a needle through mommy's tummy under ultrasound guidance. This involves sampling the baby directly and thus can provide most accurate results, almost 100% accurate. As it has a small risk of miscarriage associated with it, we usually offer these tests only to the parents who request them or to the parents who are at high risk of genetic problems. So there are screening tests, there are diagnostic tests. Let us learn more about them. How do we use them in our clinics? Let us refer to a chart to know more about them. Here it is. So as you can see, older the mother, higher is the risk of trisomy 21. Mothers above 35 are at highest risk. But as you can imagine, there are very few mothers in that category. So 70% of Down syndrome babies are born to mothers who are younger to 35. That is why the need of screening test to be offered to all the mothers and not only to the older mothers. NT scan, as you can see on the chart, can detect as many as 70 to 80% Down syndrome babies with false positive result of around 5%. As against that, a combined test which offers NT scan plus a blood test looking at two hormones, HCG and PAPA, increases the accuracy of NT to around 90% with similar false positivity of around 5%. My favorite is enhanced first trimester, which looks at the NT scan, mother's parameters, and three hormones coming into the mother's baby: HCG, PAPA, and PLGF, placental growth factor. Why is it important, do you ask? It offers better accuracy of around 92 to 96%, lesser false positivity of around 2 to 4%, and more importantly, it can tell us about high blood pressure in pregnancy, preeclampsia, fetal growth restriction, baby being underweight at the time of delivery. As many as 15% pregnancies are affected by these complications. If the mother comes to us after 15 weeks, we offer them quadruple marker, another test which looks at 4 hormones coming into our blood. One would logically think that 3 se bhale 4, so 4 hormones should give us better accuracy, but that is not true. Quadruple marker, because it is done at a later stage, gives us accuracy of around 66% with false positivity of 5%. There is another test, the new baby on the block, called NIPT, Non-Invasive Prenatal Screening. It has excellent accuracy for trisomy 21 to the tune of 99%, with very low false positivity of less than 0.01%. This test is now offered to all our patients who are older than 35 in addition to enhanced first trimester. Mind you, NIPT is also a screening test, meaning an abnormal NIPT does not mean that baby has a problem, but even those babies need a diagnostic test. As we have already seen, amniocentesis done after 14 weeks of pregnancy and CVS, chorionic villus sampling, done before 14 weeks of pregnancy are most accurate tests when it comes to diagnosis of Down syndrome. As they carry a very small risk of miscarriage, around 1 in 1000, they are usually offered only to the high risk population, meaning if your screening test shows that the risk of Down syndrome in the baby is 1% or above, I offer invasive testing. Mind you, most of the babies on invasive testing test normal and they do not have Down syndrome. This is such a reassurance to carry your pregnancy healthily thereafter. That is why even if the screening test is abnormal, you should not be scared, you should not be frightened. Just get the invasive test done and the much needed reassurance. As the time passes, we are getting better and better at predicting Down syndrome. We have more tests, more accurate tests, and sometimes more confusion. Let us learn more about your pregnancy and your baby in this program of ours, Pep Talk.